Now, each morning, you get out of bed, you put your clothes on, you head to the kitchen, and hopefully you have a bit of breakfast. It's a pretty normal, everyday kind of thing to do, isn't it? If you didn't have your balance, though, you wouldn't be able to do this so easily. And the reality is that many people, especially those older, 65 years and older, are often a bit wobbly on their feet. Now, statistics tell us 1 in 3 people over 65 are likely to have a fall each year. 10% suffer an injury, and 1 to 3% fracture their hips. So balance is a huge health consideration, and many papers have been written on the topic. Professor Stephen Lord has been working in this field for more than 20 years. He's the Senior Principal Research Fellow for the National Health and Medical Research Council and a conjoint professor at the University of New South Wales. Thank you for your time, Professor Lord.
Oh, good morning. Pleasure to be here.
Now, how would you describe the importance of balance in our society? I mean, lots more people are doing yoga and thinking about these sort of things, but have we really got our heads around how important it is?
Probably not, because as you mentioned, we take it for granted. But if you think about it, for us to stand and walk and not fall, we actually use quite a few different, what we call physiological systems to allow us to do that. So, for example, we use our eyesight to take in sensory information about obstacles in the environment. We need the inner ear to give us direct information about our balance. And we also need to get information about our sense of position and movement that continually comes from our body parts. So we get all this feedback about our balance. So that's all the sensory information we use. And then on the other side, we need to be sufficiently strong, particularly about the muscles around the lower limbs, around the knees, the ankles and the hips. We need to be able to react quickly if we lose balance or if we're knocked off balance. And then standing on 2 legs is a pretty unstable thing to do in the first place. So we need to have good control over our centre of gravity as we stand, walk and move about. So all of this is happening sort of automatically. But as we get older, some of those systems show age-related changes, and that's why falls can occur.
Just thinking about what's affected by balance, if anyone's had an ear infection, for example, or I also know someone who lost their big toe, those things that you might not think are such a huge issue, amazing how much it can throw your balance.
It's a problem from head to foot, literally. It's everything from, how your brain's working at one end, the medications you take, right through to your strength, and right down to feet, as you mentioned. Painful feet, misshapen feet, are another risk factor for falls, and if we can intervene to correct those problems, you can prevent falls.
Now, you've been researching falls prevention for years. As a general starting point, can you explain to us how a fall at 65 years or over could be detrimental to a person's health?
Sure. Falls occur at all ages, but by the ages of 65 and over, the consequences increase. So you mentioned already the risk of fractures, and that's certainly important. Wrist fractures occur in people frequently from 65 to 80, and then in older age, the hip fracture becomes more common, and that's the particular fracture that people want to avoid because that can lead to a loss of mobility, long time in hospital and rehabilitation, and a good proportion of people don't recover and actually die within a year if you suffer such a fracture. Apart from that, though, there are other related injuries. People, if they're on warfarin, for instance, might have a head bleed, and that can be very significant and a bad consequence. But even the falls that don't result in a physical injury can lead to a loss of confidence, and if that happens, it can be a bit of a spiralling effect where people do less, they get less vigour, their overall fitness declines, the chances of another fall goes up, and it can lead to a downward spiral. So it's physical and also psychological consequences.
It's interesting when you think about sort of hot topics of health and which ones are sort of the sexiest for governments to sort of launch strategies and things. Falls prevention often doesn't, get up there as a real headline grabber. No. But from a statistical point of view, it sounds like a very serious issue.
Oh, it is. With the baby boomers getting older, like myself, the need for hospital care, ambulance care, etc., is going to more than double between now and the year 2050. It is starting to get the ear of government, and New South Wales Health has in place now a policy for preventing falls, and some other things, like websites for where to find an exercise program to try and maximise your balance. So it's starting to get on the agenda, but, it is a big issue.
Are younger people prone to falls as well?
I think falls occur at all ages, and if you think about in young age, the people who get injured most from falling are the most active. They're the sports stars, the rugby players, etc. But the consequences aren't as high as older age.
I think it's been a while since I had a fall, but boy oh boy, it knocked me around.
It does. It can really affect people's confidence, and all of that just leads to being less sure, and the last thing we want to do is have people wrapped up in cotton wool. Everyone wants an active, engaging lifestyle for as long as possible, so we need to make sure people are actually steady on their feet so they can keep going doing the things they like.
Mentioning that loss of confidence, how much of this work is about building that confidence versus the physical side of things?
Well, that's some work we're currently planning to do. We're trying to, side by side, improve balance control and at the same time improve confidence as well. You can't really do one without the other. You can't make a person overconfident. That'd be dangerous. And you certainly don't want them to be underconfident. So they should go together.
So can you talk to us about some effective strategies for exercise and what's been proven to assist in the prevention of falls?
Yeah, sure. I mean, there have been over 50 studies actually done around the world that have looked at exercise as a strategy for fall prevention. And when you look at the results together, what comes out by far as the most effective component is a balance training component. So what that really means is, well, for a start, the exercises can't be done seated, so that the exercises need to be done while the person's standing. You need to sort of challenge balance by having people doing rapid stepping, or actually what's called reducing the base of support, so possibly standing on one leg or standing with feet together, and also trying to minimise the use of the arms while people are doing the balance exercises. So there are some good examples of this. I mean, Tai Chi is one. That's coordinated balance control exercise. And there are some other group-based exercises and home-based physiotherapy type exercises that also are effective. For people who want to check out some of these, there's an Active and Healthy website that can be accessed from anywhere in the country, in the state. And you can see what exercise programs are available that are considered to be good for fall prevention.
And there's one coming up in Forbes. I'll give you the details for that shortly. But yes, we certainly see a number of classes come our way from time to time targeting older people. And I guess that's really about building up core strength as well as the confidence side of things?
It's core strength. It's really balance control. So for people who are out and about, say, in their 60s and 70s, Tai Chi seems to be a good exercise. When people get a little bit older and frailer and in their 80s, I mean, a lot of the exercises become almost like activities of daily living training. So keeping the ability to get out of a chair intact, the ability to climb a set of stairs. Now, these are all crucial for fall prevention, but for some people, it's crucial just for being able to maintain their independence and stay at home. So it changes a little bit as people get older.
Yeah. Now, walking sticks and walking frames, often there's a real resistance for people to move in that direction. What are your views on using sort of walking aids generally?
It's one of those tricky ones. People don't like them. There's a stigma about them. Interestingly, we've done a study in Chinese older people, and people like them there. They see them as a sign of, seniority, and if people have a stick, it's seen to be a good thing, and they'll make sure they don't in any way put them in risk of having a fall. But in Australia, it's a bit different. In a way, if it's indicated and prescribed by a doctor or a physio, people should use them, particularly if they're out in unfamiliar environments like the street or the shopping centre. That's when they would be most useful.
So you think if it's coming from the doctor and the doctor's really thinking about the person as a whole, that it is a good thing?
I think so. And one of the things is it's very good to have them prescribed as well. Yeah. And physiotherapists are really good at that to make sure they can sum the person up in terms of whether they need the walking stick and the best type of stick that would be appropriate. Professor
Lord, I'm also interested in your views on motorised scooters. So we're seeing more and more people on these getting around out in the streets.
Yep.
Have you got a view?
Well, it's a trade-off, isn't it? I mean, if you started to use one of these too early, you're losing all of your independence in being able to get the benefits of exercise. So, on the other hand, it might be the case for some people that it still allows them that independence to go a little bit longer. So it's one of those, conundrums. It's hard to give a straight answer to that. I do know that there's, in some studies overseas, when older people also have a dementia and they're using these, you can imagine that we're coming into a new form of accident category here.
Yeah. Another question I had was if people have an injury of some sort, they've hurt their back, for example, whether these sorts of Tai Chi classes and different sort of gentle exercises that you're talking about, whether it's okay to do that.
Well, again, it's a bit hard to give a blanket answer. It would be good to get the advice of a doctor before taking part in any exercise program, and also if something's done by a trained trainer or physiotherapist, they'll be able to assess that to see if it's safe.
Now, are you happy to take a call from a listener, Professor?
Yes, sure.
Euless is on the line. Hi, Euless.
Hi.
What would you like to know?
Well, I just wondered whether there'd been any comparisons between communities where there's a strong skiing and skating environment as opposed to areas where there aren't, or even bicycle. No, I'm thinking more skiing and skating, because skiing and skating you learn to fall and you also use your balance very strongly, and it continues for many years in people's lives.
Yes, I don't think there's been a study that's looked at that, but it's clear that some people have looked at training older people to fall, and they haven't used skating so much, but they've actually used judo, and the way judo players fall is also very protective. So there's something in that as well. It's, of course, a very tricky thing to do, to train a person how to fall who's at risk of fracturing if they do. So it's not something that's been done in Australia as yet.
I didn't actually mean to use it now. I mean people who have done it at a young age. Do they have less likelihood of falling? And if they do they fall better?
Yeah, I don't know of anything, but yes, it's certainly possible.
Euless, is that from your experience in Europe and your travels there and what you're seeing?
Because I have skated all my life. I have skied all my life. I won't exactly tell you how old I am, but I won't see 70 ever again. I still do it, and I still fall, but I don't hurt myself. I don't know whether it's... I just feel that it's because I've done it all my life. I've never really stopped doing it except when I was having children. And I think that maybe it has protected me a heap.
Yeah, I mean, it's possible. Well, this is all motor learning, so it's something just gets, into your system in the way you approach your walking and your balance, and it's certainly possible that these things can, last a lifetime.
Yeah.
Well, because they strengthen your muscles too.
Yep.
Yeah. Good on you, Euless. Thank you for that. Professor Lord, can you mention that website again that you were talking about?
Yeah, it's called Active and Healthy, and if you just Google that, you'll find it. It's a New South Wales health website, and you can just go into that and find, put in by postcode where you live, and it'll come up with the available exercise programs that have been considered by New South Wales Health and experts as having a direct role to play for fall prevention.
Good on you. I really appreciate you having this conversation with us this morning. Thank you so much for your time.
Thank you.
There's the Senior Principal Research Fellow with the NHMRC, and he's a conjoint professor at the University of New South Wales, Stephen Lord there. And if you're in the Forbes area, Forbes Health Service will be holding a falls prevention morning in the Go Active Centre on this Friday from 10 till 12. As we were hearing, there's lots of different activities around the region, so do have a little look. The one in Forbes is going to be talking you through Tai Chi, gentle exercise for falls prevention, and everyone is welcome to attend. We've got news headlines coming for you in just a sec.